Good evening, everybody. I'm Sayukta from Bladder Wellness Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, management of overactive bladder. Overactive bladder, also known as OAB, is a medical condition characterized by a sudden and uncontrollable urge to urinate, often accompanied by frequency and nocturia, that is, waking up multiple times during the night to urinate. It can significantly impact a person's quality of life, causing embarrassment, anxiety, and social limitations. In India, like in many other countries, overactive bladder affects a considerable number of people. Dealing with overactive bladder in India involves a combination of medical interventions, lifestyle modifications, and awareness campaigns. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of overactive bladder, today we have with us renowned urologist Dr. Shriyansh Chahar, who is a urologist, andrologist, and renal transplant surgeon practicing at Dr. Shriyansh Urology and Kidney Clinic at Agra. Dr. Chahar has rich experience in the field of urology. He is one of the best urologists in Agra and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Shriyansh Chahar.
Thank you very much. Good evening to all.
Good evening, doctor, and it's such a pleasure to have you with us. And today, as we are talking about a very important thing, something that affects the quality of life of people, and which is quite common, but people hesitate to talk about it, which is OAB, overactive bladder. First of all, doctor, we would like to understand OAB kya hota hai, what is OAB?
See, to begin with, as you have already said in your introduction, overactive bladder, or in short, if we say OAB, it is a medical condition, it is a clinical condition, which is defined by the International Continence Society as a condition which is characterized by urinary urgency. The main symptom of this condition is urinary urgency. The patient feels sudden urge to pass urine, which is difficult to hold, and this urgency is most of the time accompanied by increased frequency of micturations. Like the patient has to pass urine again and again during the daytime and also in the night time. That is called nocturia. So this combination of symptoms of urinary urgency accompanied by increased frequency and nocturia is termed as overactive bladder. And in overactive bladder, urgency may also be accompanied by urge incontinence. Patient is not able to hold the urine, and at times he or she may leak the urine in her or his clothes itself. So, urinary incontinence may or may not be a part of this clinical condition, but urgency, increased frequency, and nocturia are usually the symptoms. And also, we should understand that these problems are also a representation of other diseases also, like urinary tract infection, urinary bladder stone, urinary bladder cancer, and other clinical conditions. So we have to rule out all these other conditions. When urinary tract infection is ruled out, urinary bladder stone is ruled out, urinary bladder cancer is ruled out, and still these conditions are present, then this condition is called as overactive bladder.
Right. You have very well explained what is overactive bladder, and we would also like to understand, doctor, what causes OAB? What are the general causes responsible for an overactive bladder?
See, if we go into the pathophysiology of this disease, there are various theories which have been proposed. Overactive bladder क्यों होता है? But rather than to give focus on these theories, because these theories are for medical purposes only, from the point of view of a clinician only. But for the general purpose, the general population, I would say that there are certain risk factors. If these risk factors are present, then the chances of overactive bladder are more to a patient. Why does this condition happen? This happens because our urinary bladder contracts more at low urine volumes. It becomes more sensitive to contraction at low urinary volume. So it contracts and the patient feels the urge to pass urine. There are multiple theories that, like, there is activation of the nervous system, the muscles of the urinary bladder became more sensitive to certain stimuli, and there are multiple theories to this. But for a common man's point of view, we should understand that there are certain risk factors, and these risk factors are: number one, increasing age. Increasing age is a risk factor for overactive bladder. Obesity, more weight, is a risk factor for overactive bladder. Then certain medical conditions like diabetes mellitus, certain neurological conditions are also a risk factor for overactive bladder. Then certain dietary factors like excessive intake of caffeine in the form of coffee, tea, and excessive intake of soft drinks, carbonated drinks, alcohol. All these food products are irritant to bladder, so they irritate the bladder, and certain bladders which are more sensitive to these substances become overactive.
Right. I have heard people saying कि अच्छा ये हो रहा है urgency या frequency of urination है तो मेरी age हो रही है या फिर मैं diabetic हूँ, so you know I'm bound to have this. There is no cure. I'll have to live with it. This is a very normal concept that people generally have. I'm sure आपके भी ऐसे पेशेंट्स आते होंगे जो बहुत टाइम बाद डॉक्टर के पास आए, क्योंकि इससे पहले तो उन्हें यही लगता था कि ये तो एज के साथ या अगर आपको दूसरे कॉम्प्लिकेशंस है तो ये तो होगा ही और इससे कोई निजात नहीं है। इस पर आप क्या कहना चाहेंगे डॉक्टर?
Yes, yes, you said it very right. Because most of the patients, when they do come to us, they say that they have been suffering from this problem for a very long time. बहुत दिनों से हमको ये तकलीफ है, कभी किसी डॉक्टर को दिखाया नहीं है, कभी प्रॉपर इसका इलाज नहीं करवाया। वो लोग सोचते हैं कि अब हमारी उम्र हो गई, 60 साल की उम्र हो गई या 50 साल की उम्र हो गई, मुझको शुगर भी है, तो उसकी वजह से ये इन्फेक्शन होता रहता है, इसकी वजह से ये यूरिन में प्रॉब्लम होती रहती है। बट इट इज नॉट द एग्जैक्ट केस। Though increased age is a risk factor, though diabetes mellitus is a risk factor, but it is not like that these patients should suffer like this. They should immediately, whenever they feel such problems, they should immediately consult their urologist. And the urologist, in a systematic manner, they will rule out other causes also. It's not like that every patient coming with these symptoms will be having an overactive bladder. Most patients will be having urinary tract infection, and on the treatment of that urinary tract infection, their symptoms will go. Some patients will have urinary stones. After the treatment of stones, these symptoms will disappear. So the treatment of the cause, first of all, treatment of the cause should be given, and even after the treatment of the cause and infection and all those things have been ruled out, still patient is having all these symptoms, then we should manage the patient on the lines of management of overactive bladder. But the thing is that just because patient is aging, just because patient is having diabetes and other medical condition, he or she should not suffer from these conditions. They should promptly consult a urologist to get relief of these symptoms.
राइट। तो ये बॉटम लाइन है कि अगर ये सिम्टम्स हैं, ये साइंस हैं, तो प्लीज गो एंड कंसल्ट अ यूरोलॉजिस्ट। डोंट सफर इन साइलेंस। इसको लेके बात करना बहुत जरूरी है क्योंकि इसका ट्रीटमेंट है, क्योर अवेलेबल है। नाउ द क्वेश्चन arises, doctor, that are there any specific tests or evaluations that you do as a doctor to confirm that it's an OAB या फिर ये किसी और वजह से हुआ है? तो क्या टेस्ट आप नॉर्मली करवाते हैं?
See, when a patient comes to us with these symptoms, primarily, जब पहली बार हमारे पास पेशेंट आता है और ये हमको बताता है कि उसको यूरिन में बार बार यूरिन जाता है, दिन में रात में यूरिन होल्ड करने में प्रॉब्लम है, एक बार आता है तो उसको जल्दी से वॉशरूम की तरफ जाना पड़ता है, या फिर कभी कभी यूरिन लीक भी हो जाता है, then we have to, in a systematic manner, see the patient, listen to his or her history, वो कितने दिन से symptoms हैं, कितनी उसको बॉदरसम सिम्टम्स हैं, उसको कितनी प्रॉब्लम हो रही है अपनी डे टू डे लाइफ में उसकी वजह से सिम्टम्स में, साथ में उसको पुरानी मेडिकल कंडीशंस क्या है, इज द पेशेंट कोमॉर्बिड हैविंग डायबिटीज, ब्लड प्रेशर, हाइपरटेंशन, अदर एनी अदर न्यूरोलॉजिकल कंडीशंस. After taking a thorough proper clinical history, we should examine the patient. There are many things that we can just find out by properly examining the patient, whether there is any in females, whether there is any prolapse, pelvic organ prolapse is there, or whether the patient is having bladder outlet obstruction in the form of enlarged prostate, and any previous surgeries are done on the patient, whether the neurological status of the patient is okay or not. So these are the things which we can interpreted by properly examining the patient. Clinical and physical examination should be done. After this, to rule out urinary infection, there is a very simple basic test of urine routine examination and urine analysis and culture, by which will come to know whether the patient is actually having urinary tract infection or not. Then another very basic investigation is an ultrasound of the abdomen. This ultrasound of the abdomen is usually done to see whether there is any high post void residual volume. मतलब यूरिन पास करने के बाद पेशेंट का यूरिन ज्यादा तो क्वांटिटी में नहीं रह जाता है ब्लैडर में, जिसकी वजह से उसको ये सिम्टम्स बार बार आते हैं, बार बार यूरिन पास करने की फीलिंग होती है. And the third one is a very useful tool which we use is a bladder diary. हम लोग पेशेंट्स को बोलते हैं कि कम से कम 3 दिन का एक ऐसा चार्ट बनाकर लेकर आए जिसमें पेशेंट किस टाइम पर क्या लिक्विड ले रहा है और किस टाइम पर यूरिन जा रहा है और किस टाइम पर उसका यूरिन लीक हो रहा है. तो एक 3 डेज का 24 आवर का चार्ट बनाने से हमको ये भी पता चल जाता है कि कहीं पेशेंट का ओरल इनटेक बहुत ज्यादा तो नहीं है लिक्विड्स का. तो अगर कुछ ऐसे पेशेंट्स होते हैं तो उनका हम डाइटरी मॉडिफिकेशंस करने के साथ साथ ये सब मैनेज कर सकते हैं. तो बहुत ज्यादा हाई फाई इन्वेस्टिगेशंस नहीं है. पेशेंट को ये नहीं सोचना चाहिए कि हम डॉक्टर के पास जा रहे हैं, वो हमको बहुत बड़े बड़े सीटी एमआरआई और ये सब चीजें लिख कर दे देंगे, ऐसा नहीं है. बहुत ही बेसिक इन्वेस्टिगेशन, यूरिन के लैब इन्वेस्टिगेशन, एक छोटा अल्ट्रासाउंड, इसी से हम आगे का इवैल्यूएशन प्लान तैयार कर सकते हैं.
राइट. एंड एज यू मेंशन डॉक्टर कि आप जब वो डायरी या चार्ट 3 दिन का बनवाते हैं तो उसमें ये भी वो करते हैं कि कितना फ्लूइड कंज्यूम किया है. एक बहुत ही आम कॉन्सेप्ट अगेन हमारी सोसाइटी में है कि हमें बहुत ज्यादा पानी पीना चाहिए और उस पानी में हम फ्लूइड कैलकुलेट नहीं करते, हम सिर्फ पानी कैलकुलेट करते हैं. तो कुछ लोग तो 8 से 10 लीटर सिर्फ पानी पी जाते हैं, उसके अलावा जो दूसरे फ्लूइड कंजम्पशन है वो तो है ही. चूंकि ये बात आई है और वो इस टॉपिक से बहुत रिलेटेड एंड रेलेवेंट भी है, तो मैं आपसे जानना चाहूंगी एडिक्वेट वाटर क्या होता है. हमेशा कहा जाता है ना एक्सेस ऑफ एवरीथिंग एंड एनीथिंग इज बैड. क्या पानी या फ्लूइड के केसेस में भी अप्लाई होता है डॉक्टर?
या डेफिनेटली अप्लाई होता है. एक्सेस एंड डेफिशिएंसी ऑफ एनीथिंग इज नॉट गुड. And if we talk about overactive bladder, I would mention it very prominently here that excess of liquids and even deficiency of liquids may lead to overactive bladder. It's not like कि patient बहुत ज्यादा पानी पी रहा है उसकी वजह से ही उसको ये symptoms आएंगे. कई बार patient बहुत कम पानी पी रहे हैं, पूरे दिन में 1 या 2 ग्लास भी पानी पीते हैं, उन patients में भी ये problems आती है. Now coming to your question that what is the adequate amount of water or liquids one should take. See, as a urologist, I would say that the amount of liquid which one should take should be adjusted with the amount of urine one is passing and the consistency and the color of the urine. A healthy person, a healthy individual should pass around 2 to 2.5 liters of clear urine per day. So to achieve this amount of urinary output, a person should drink at least 3 to 4 liters of water, plain water, and also, if possible, they should avoid excess tea, coffee, carbonated drinks, alcohol. And if they are taking milk, 1 or 2 tea in a day, they should be adjusted in that amount on itself, only 3 to 4 liters itself, so that they are passing 2 to 2.5 liters of clear urine. If the color of the urine is very dark, then they should drink more water.
Right. So this is a good way to evaluate how much we are drinking and how much we should actually. Doctor, we are talking about that, anything which is not normal in terms of urination, if you are going for, more frequently during the day, during the night, then it may be OAP. Now the thing is कि again हमें नहीं पता कि urination का क्या एक normal, आपने liters में जरूर बताया, लेकिन कई लोग रात में एक बार उठना उनको लगता है यूरिनेशन के लिए, एक बार तो उठते ही हैं सब. कई लोगों को 2 बार भी नॉर्मल लगता है. तो स्पेशली अगर मैं रात की बात करूं तो क्या नॉर्मल है और क्या नॉर्मल नहीं है, जब हमें ये मानना चाहिए कि ये OAB है?
If we go by the definition of what is nocturia, nocturia is a medical term which means to get up again and again during the night from the sleep to pass urine with the intention to pass urine. So nocturia by definition is passing urine more than 2 times in a night. So if a person is passing urine more than 2 times in a night, he or she has to get up just because she is feeling to pass urine more than twice in a night. This is called nocturia. It should be taken care of. And similarly, during the daytime, 4 to 6 times passing urine is okay. If the person is passing more times of urine and with a limited quantity of urine liquid intake, if a person is drinking excessive more intake liquids, then definitely he or she will pass more urine. But with a normal intake, if he or she is passing more than 6 times in a day, then it will be called an increased frequency during the daytime and more than 2 times during the night time.
Okay, doctor. Is there any genetic connection? If I'm suffering from OAB, is there a probability that my family is also at risk?
No, see, actually, studies they don't exactly prove that there is a genetic. That, if my parents are suffering from these conditions, then I will also suffer from these conditions. But yes, it is more commonly seen in females. If the it may be because of the other genetic problems like medical conditions are there, like diabetes and other these things are there, then they are more likely to be present in you also. So, as we can relate them, but not exactly genetic condition.
Okay. We always say, especially in medical sector, that prevention is always better than cure. How can we prevent OAB, doctor?
See, there are two things. One is the treatment and one is the prevention. Treatment comes when the condition is already there.
Hmm.
When the treatment comes, when the disease is always there, and the prevention comes before the disease starts. So, from the preventive point of view, I would there are certain uh, lifestyle habits which one should uh, apply. Like we should not allow our weight to increase excessively. We should always keep our body physically active. We should always keep our blood sugar, blood pressures under check. Always see if there is any neurological problems throughout in our body. We should avoid constipation. And then comes to the dietary part. We should not indulge in taking too much of teas, too much of coffees, too much of alcohol, too much of spices, too much of soft drinks, cola, and all those things. If we are taking care of all those things, I'm quite sure that many people will not develop all these things.
Right. एक इसी से रिलेटेड क्वेश्चन हमारी एक व्यूअर ने पूछा भी है, प्रणिता है उनका क्वेश्चन है, आर देयर एनी स्पेसिफिक डाइटरी चेंजेस और रिस्ट्रिक्शंस दैट कैन इंप्रूव माय कंडीशन? तो खाने पीने में कुछ चेंजेस हम कर सकते हैं?
Yes, definitely खाने पीने के में चेंजेस करने से बहुत ज्यादा फर्क पड़ता है. सबसे पहले खाने पीने के चेंजेस में, जैसा कि मैंने आपको बताया, बहुत ज्यादा या बहुत कम पानी पीना सही नहीं है. दूसरा, कुछ लोग होते हैं, हम कंडीशन लेकर आते हैं हमारे पास, ये वाली प्रॉब्लम्स, ओवर एक्टिव ब्लैडर के सिम्टम्स बताते हैं, फिर हम उनसे पूछते हैं कि आप चाय कॉफी कितने पीते हैं. बोले सर दिन की 8-10 चाय तो हो ही जाती है. तो दिस इज नॉट गुड. 8-10 चाय किसी भी कंडीशन में किसी भी के लिए ठीक नहीं है. They should cut short. Minimum, if they want to have, at the max they can have 2 tea. Should not drink too strong tea, too strong coffee. They should cut down on their soft drinks like carbonated, all these things. Alcohol, too much of alcohol is not advisable. Spices play a very important role in this overactive bladder. They should avoid spices. They should eat very minimal or bland food. So these are the main things, like fluid intake, avoid teas and coffee, avoid alcohol, avoid spices. These are the main dietary modification one should make.
Right. एक और बहुत अच्छा सवाल ज्योत्सना मेहता का है, कैन यू रिकमेंड एनी एक्सरसाइजेस और टेक्निक्स टू स्ट्रेंथन द पेल्विक फ्लोर मसल्स? क्योंकि कई बार इन women especially after delivery and all, they develop this problem. Yes, doctor.
Yes. Overactive bladder, this thing The exercises play an important role in those patients of overactive bladder who primarily are bothersome with their urinary incontinence. The patients who leak their urine without control, in these patients, these exercises play a very important role. These exercises are primarily basically called Kegel's exercises. These are used to strengthen the pelvic floor muscles so that they can hold the urine for a longer time. The exact Kegels exercises are available on YouTube. I will recommend every person who is suffering from these problems to go to YouTube. It is available in Hindi, it is available in various languages to search for Kegels exercises. एंड दे शुड दीज आर नॉट एक्सरसाइजेस जिसके लिए हमको कहीं अलग से टाइम निकाल कर दिन में अपना अलग से टाइम करना है या उसके लिए कुछ अलग करना है दीज आर द एक्सरसाइजेस व्हिच वन कैन डू व्हाइल डूइंग अदर एक्टिविटीज आल्सो लाइक इफ फीमेल्स if they are in the kitchen they can do these exercises while cooking food and males and females they can do their exercises while they are at their office work desk work if they are watching TV they can do all these exercises while doing such things and if they have to do the more number of times these exercises are done, the more benefit they will get. Another, there are certain other pelvic floor muscle strengthening strategies like vaginal. There are certain vaginal cones which are capped into the vagina, and the patient is asked to hold that cone for long so that the pelvic muscles are strengthened. So the most important are the Kegels exercises, the details of which and how to do them are available on YouTube. One should go there.
Right. And doctor, what are the treatment options available for OAB?
For any disease, we have different treatments, and these treatment options come at different stages of the disease. It's not like for every overactive bladder patient we will prescribe surgery, or for every overactive bladder patients we will prescribe multiple medications. So it is a stepwise approach, which include first thing is the patient should know about overactive bladder. We should educate the patient what it is, what is the condition, how it happens, what are the risk factors, and what are the treatment options. Patient को पता होना चाहिए उसकी बीमारी के बारे में कि वो क्यों हो रही है, उसके रिस्क फैक्टर्स क्या हैं, जो उस पेशेंट के अंदर है वो रिस्क फैक्टर्स क्या हैं, और इससे हमको कैसे ट्रीटमेंट का कराना है. Second, which we have already discussed, like lifestyle modifications. Lifestyle modifications in terms of dietary modifications, in terms of behavioral modifications. And another important part of lifestyle modification is that bladder training. Whenever the patient feels that he or she has to pass urine urgently, they should sit somewhere and keep their mind calm for few seconds, for a few minutes. They should distract their mind from urinary part to something else. They should do some mental calculation. They should think about something else till that urge of passing urine passes off. थोड़ी देर बाद वो अर्जेंसी एकदम से चली जाएगी, उसके बाद वो अपना नॉर्मल काम करें, एंड व्हेन द अगेन दे फील यूरिन दे गो टू द वॉशरूम एंड पास यूरिन. सो दिस इज द ट्रेनिंग ऑफ द ब्लैडर को ट्रेन करना है हमको कि कैसे यूरिन को बहुत देर तक होल्ड करना है. Lifestyle modification, dietary modifications. Then comes the role of medicines. There are certain medicines which we have, anticholinergic, antimuscarinics, and another medicine is Mira background beta 3 agonist. ये ब्लैडर को रिलैक्स करते हैं. ओवरएक्टिव ब्लैडर में ब्लैडर बहुत जल्दी जल्दी कॉन्ट्रैक्ट करके यूरिन पास करने की कोशिश करता है. तो these are all these medicines, they calm down the bladder, they relax the bladder, and they decrease the contractions of the bladder. So most of the patients will get benefit with the combination of lifestyle modifications plus medicines.
बिल्कुल. तो लाइफस्टाइल मॉडिफिकेशन है, उसके अलावा मेडिसिन तो है ही जिसकी मदद ली जा सकती है, लेकिन इन सबसे पहले जरूरी है कि हम एक डॉक्टर से, एक यूरोलॉजिस्ट से संपर्क करें बिना वक्त गवाए. कुछ और हमारे व्यूअर्स के सवाल मैं ले लूंगी. सक्षम बेनवाल है, पूछ रहे हैं, शुड आई बी कंसर्न्ड अबाउट माय पोटेंशियल इंटरैक्शंस बिटवीन माय करंट मेडिकेशन एंड ओवरएक्टिव ब्लैडर ट्रीटमेंट्स?
Most of the overactive bladder medicines, they do not interfere with other medicines, but one should always be cautious. One should always consult their primary other physician, like if they are taking medicines for diabetes mellitus, or if they are taking treatment for hypertension or any other neurological conditions, then they should always consult their primary physician that I am also taking treatment for overactive bladder. These are the medicines which my urologist have prescribed. So shall I continue taking them all together, or shall I stop one medicine or the other? For example, many patients of hypertension, they take diuretics. So diuretics, what the diuretics do, they increase the quantity of urine produced by the body. If the urine production is increased, definitely the patient will go urine again and again. So from a physician point of view, we cannot stop diuretics from their point of view, but we also have to give treatment from our side also. So the physician and the urologist, they modify the timing schedule of all these medicines. Which medicine has to be taken what time, which medicine has to be taken what time, and in such a way, both the medicines can be taken together.
Right. Rahul Pateria is here. His question is, can you please explain the potential benefits and risks of any surgical procedures that may be recommended for overactive bladder?
See, surgical procedures for overactive bladder, the part of surgery in overactive bladder comes very late. It comes when all the measures of lifestyle modification, when all the measures of medicines have failed, which is very rare. Most of the patients will definitely get benefit from lifestyle modifications plus medicines and plus treatment of their other comorbid conditions. Even after that, if very few patients, they do not respond to the medical treatment, then comes the role of surgical treatment. And surgical treatment comes in the two forms. There are minimal invasive treatments, and after that, there are the proper surgical treatments. Minimal invasive treatments, there are in the form of botulinum toxin injection in the bladder. Then sacral nerve modulation are there, and posterior tibial nerve stimulations are there. These are the treatment options which we offer to the patient which who have failed, which we have tried all types of medical treatment for a long time, but they have not responded. But the problem with these surgical intervention is that we have to repeat them time and again. It's not like a one time shot that एक बार हमने बोटॉक्स इंजेक्शन दे दिया या एक बार पीटीएनएस कर दिया या सैक्रल मॉड्यूलेशन कर दिया, उसके बाद कभी लाइफ में जरूरत नहीं पड़ेगी, इनको दोबारा करने की जरूरत पड़ती है। कुछ पेशेंट्स वेरी अनफॉर्चुनेट, बहुत ही अनलकी कुछ पेशेंट्स होते हैं जो इनके बाद भी, इन इंटरवेंशंस के बाद भी रिकवर नहीं करते हैं। उन पेशेंट्स में हमको फिर प्रॉपर सर्जरीज करनी पड़ती हैं। प्रॉपर सर्जरीज मीन वी हैव टू ऑगमेंट देयर ब्लैडर, देयर उनका ब्लैडर को बड़ा करना पड़ता है, आइदर बाय incorporating a part of their intestine in the bladder so that the bladder size will increase and they can accommodate large amount of urine. But it comes very late in the treatment plan, and very few people will need this.
बिल्कुल। तो ये ऑप्शंस भी अवेलेबल है, लेकिन इनकी जरूरत बहुत कम लोगों को पड़ती है और बहुत बाद में पड़ती है। तो राहुल, घबराइए मत। अगर अर्ली सिम्टम्स हैं तो प्लीज सही समय पर ही एक यूरोलॉजिस्ट से संपर्क कीजिए। सुहानी कुमारी है, हालांकि इस पर डॉक्टर हमने पहले भी बात की, लेकिन हो सकता है सुहानी जैसे दूसरे व्यूअर्स ने सेशन बाद में ज्वाइन किया हो। इज देयर अ पॉसिबिलिटी दैट माय ओवरएक्टिव ब्लैडर सिम्टम्स कुड बी कॉज्ड बाय अनदर अंडरलाइंग कंडीशन?
Yes, definitely. Overactive bladder symptoms, the symptoms of urinary urgency, increased frequency, nocturia, and urinary incontinence. These symptoms can be a sign. These symptoms may be or may also be present if you are having urinary tract infections, if you are having urinary tract stones, if you are having urinary tract cancer, or also in females usually. Uh, Many a times few females come and they say that whenever they laugh loudly and whenever they cough and sneeze, they leak urine. So it is another condition which is called stress urinary incontinence. So these are the condition, and in male patients with a large prostate, which we call BPH, in these patients also they will have the symptoms of increased urgency, frequency, nocturia. So we have to clear that the patient is not having any of these conditions, and overactive bladder symptoms are not because of these conditions. So, Suhani, we should keep in mind that these symptoms may be present because of other medical conditions also.
बिल्कुल, तो ये हो ही सकता है और इसीलिए हम बार-बार कह रहे हैं, ये जो पूरा सेशन ऐसे करने का एक मकसद ये भी है कि हम आप सभी को ये बता सकें कि ओएबी क्या है, क्यों हो सकता है और क्यों ज़रूरी है कि अगर ये सिम्पटम्स हैं, तो हम एक विशेषज्ञ से, एक एक्सपर्ट से यानी एक यूरोलॉजिस्ट से संपर्क करें। हम ओएबी पे बात कर रहे हैं डॉक्टर और चूँकि हम कह रहे हैं कि ऐज भी एक रिस्क फैक्टर डेफिनिटली है, ऐज की वजह से भी ये सिम्पटम्स होते हैं। अब अगेन आपने भी कई ऐसे पेशेंट्स देखे होंगे जिनको जब अर्जेंसी या फ्रीक्वेंसी की दिक्कत होती है मेनी टाइम्स यू नो वी स्टॉप गोइंग आउट, वी स्टॉप सोशलाइजिंग, वी स्टॉप गोइंग इन पब्लिक। महिलाओं को भी अलग-अलग तरीके की बहुत सारी एम्बैरेसिंग सिचुएशंस फेस करनी पड़ती है, तो बहुत हम अपने आप को वो जो मैंने शुरुआत में भी कहा कि वी कीप ऑन सफरिंग इन साइलेंस, बट हम लोग उसको लेकर बात नहीं करते, डॉक्टर के पास नहीं जाते। एक और बहुत आसान तरीका जो एडल्ट्स के लिए अब अवेलेबल हो गया है वो है एडल्ट डायपर्स। तो कई बार तो हमें पता भी नहीं होता कि ये ओएबी जैसा भी कुछ हो सकता है या इसका एक ट्रीटमेंट भी है, हमें इससे रिलीफ मिल भी सकता है, तो हम डॉक्टर के पास नहीं जाते, हम एडल्ट डायपर्स का इस्तेमाल कई लोग करते हैं और उसकी वजह से भी तमाम दिक्कतें होती हैं। तो ऐसे वो तमाम लोग हमारे बहुत सारे व्यूअर्स आई एम श्योर इस वक्त देख रहे होंगे जो अभी तक तो ओएबी के बारे में जानते ही नहीं थे या वो एडल्ट डायपर्स या इस तरह के ऑप्शंस का इस्तेमाल करते हैं, उनके लिए आप क्या कहना चाहेंगे?
सी, हमारे पास जब एल्डरली पेशेंट्स आते हैं, या तो मेल्स हो या फीमेल्स हो, तो उनका मेन कंसर्न यही रहता है, व्हेन एवर वी आर गोइंग आउट वी हैव फाइंड अ प्लेस कि हमको फटाफट से जल्दी यूरिन पास करने के लिए वॉशरूम कहाँ मिल जाए। हम हर समय यही देखते रहते हैं, किसी फंक्शन में जा रहे हैं, कहीं पर ट्रेवल कर रहे हैं, तो उनका माइंड एक ही तरफ रहता है कि वॉशरूम कहाँ है, वॉशरूम कहाँ है, ऐसी कंडीशन में। तो उनसे पूछते हैं कि आप टाइमली आप ऐसा क्यों लगता है, उनको लगता है कि अगर वॉशरूम जल्दी नहीं मिलेगा तो हमारा यूरिन हो जाता है। So this is primarily a symptom of overactive bladder. If we have ruled out other things, then what we can do for such patients, like what we have told in the treatment part, all these things, medicines and all those things which we are saying, even after that, if patients are having this urinary leak problem, they should not feel ashamed of all these things. The thing which you have mentioned is adult diapers. Adult diaper is not a bad thing to use. It can be used when someone is going out of the house. Uh, but the problem is that many patients are not aware about the availability of our adult diapers also.
Right.
When we tell them that you can use diapers, they say that diapers तो बच्चों के आते हैं.
बिल्कुल।
So this is so we should tell them that no, बच्चों के तो आते हैं. Adult diapers are also there and they are made for the purpose of this only. For these patients only, these adult diapers are made, that whenever they are traveling out, they are going out of the house and they are not sure whether they will get washroom or not, they should use adult diapers. So if any by chance, if their urine leaks, the diapers help them.
बिल्कुल, तो एडल्ट डायपर का भी इस्तेमाल किया जा सकता है, लेकिन सबसे ज़रूरी है कि हम एक डॉक्टर से पहले संपर्क करें और उसके बाद जितने ऑप्शंस होंगे वो डेफिनिटली हमें बताएँगे। ये भी आपसे जानना चाहेंगे डॉक्टर पोटेंशियल कॉम्प्लिकेशंस क्या हो सकते हैं इफ ओएबी इज़ लेफ्ट अनट्रीटेड, अगर हम नहीं दिखाए डॉक्टर को, कोई ट्रीटमेंट नहीं करे, कितना वर्स हो सकता है? हमारे सिम्पटम्स कितने बिगड़ सकते हैं?
See, overactive, if someone is suffering from overactive bladder symptoms and he or she is not taking proper or any type of medical treatment, then the things can worsen. Worsen in the sense that if it is a if urinary tract infection is the cause of overactive bladder symptoms, and if these are not treated at time, then it may lead to serious complicated urinary tract symptoms, may lead to septicemia and sepsis. If a male patient is having BPH, and because of BPH he is having overactive bladder symptoms, and if it is not treated at time, then he may need surgery in the future. Then his urine may completely block. He may go into urinary retention. He may pass blood in the urine. He may experience urinary tract infections again and again. So these are the problems if not taken care of. care of. Similarly, if there are some stones in the urinary system right from the kidney to the bladder, and if these are not taken care at the proper time, then they may damage the kidney, urinary tract, and may lead to severe kidney problems. Apart from these, if we talk about only overactive bladder, other than all those things, pure overactive bladder symptoms, if these are not taken care of, then it may lead to urinary tract infection. It may lead to skin problems in the private parts because of again and again urinary leaks, and other than these medical complications, the problem that the patient may suffer mentally, and because this will hamper their day-to-day life activities, their social activities, their professional activities. They may have to miss from their work. They have to take leave from their work. They have to miss their day-to-day daily activities. So these are the mental problems are also there. Psychological issues may also be there.
बिल्कुल, तो डेफिनेटली हमारी क्वालिटी ऑफ लाइफ खराब होती है, हमारा बहुत ज़्यादा स्ट्रेस होता है और इन सब से हमें रिलीफ मिल सकता है अगर हम सही वक़्त में डॉक्टर से संपर्क करें। डॉक्टर, ये समस्या तो है और हम बार-बार उन लोगों को एड्रेस कर रहे हैं जो इससे सफ़र कर रहे हैं, जिनको ये सिम्पटम्स है, एटलीस्ट अगर फ्यूचर में हो तो हमें पता हो कि अच्छा ओएबी ये हो सकता है और हमें क्या करना चाहिए। लेकिन आई एम श्योर कई बार ऐसा होता है क्योंकि ये कुछ ऐसे टैबू टॉपिक्स हैं जिस पे घर पे भी बात नहीं की जा सकती। हमारे बड़े बुजुर्ग हम देख रहे हैं कि वो रात में बार-बार उठ रहे हैं, व्हिच इज़ नॉट नॉर्मल, या दिन में भी बार-बार वॉशरूम जा रहे हैं। कई बार तो बुजुर्गों के लिए बार-बार वॉशरूम जाना अपने आप में खास तौर पे रात पे जाना डेंजरस भी हो सकता है, बहुत रिस्की होता है, उनका पैर फिसल सकता है, रात में नींद होती है, नींद भी पूरी नहीं हो पाती है, तो बहुत एसोसिएटेड कॉम्प्लिकेशंस भी होते हैं। ऐसे में आप जो फैमिली मेंबर्स हैं, उनसे क्या कहना चाहेंगे? अगर इस तरह के सिम्पटम्स हम अपनी फैमिली में किसी में नोटिस करें, तो हमें क्या करना चाहिए?
This is a very good question because the treatment of overactive bladder not only involves the doctor and the patient, but it should also involve the family members of the patient also.
Right.
The family member should understand that overactive bladder is the symptoms of overactive bladder is not because of the patient's fault or any disease. किसी भी आपके ग्रैंड पेरेंट्स हैं या पेरेंट्स हैं, वो अगर बार बार यूरिन जाने के लिए बोल रहे हैं या उनका यूरिन कभी कभी कपड़ों में लीक हो जाता है, तो ये उनकी गलती नहीं है। दिस इज अ मेडिकल प्रॉब्लम और उसका हमको समाधान करना है, बजाय इसके कि हम उनसे चिढ़े या उन पर गुस्सा करें या उनको ही बोलें कि आप क्या कर रहे हो। ये उनके कंट्रोल में नहीं है। अगर कंट्रोल में होता है तो कोई भी अपने कपड़ों में यूरिन लीक करना चाहता है। सो वन शुड अंडरस्टैंड दैट दिस इज अ मेडिकल प्रॉब्लम and the patient needs proper care, proper vigilance, especially for the elderly if they are going again and again to the washroom during the day and during the night. I would recommend that somebody should accompany them. They should उनके साथ तक एटलीस्ट वॉशरूम तक जाएं, उनको वापस लेकर आए, बिकॉज मोस्ट ऑफ द टाइम ये लोग एल्डरलीज होते हैं, बहुत ही फ्रेजाइल होते हैं, मूवमेंट्स उतने अच्छे नहीं होते, नींद में कभी भी दे कैन स्लिप, दे कैन फॉल, दे कैन इंजर देमसेल्व्स। So these things should not happen in the presence of a family member. Here comes the very important role of a family member. Secondly, they should also take their parents or grandparents who are suffering from these medical conditions to a qualified doctor, to a qualified urologist for a proper consultation, and they should follow what their urologists are saying about the lifestyle modification. हो सकता है उनके पेरेंट्स बहुत ज्यादा स्पाइसी खाना खाते हैं, कुछ लोगों को चाय कॉफी की बहुत ज्यादा आदत होती है, तो उसमें फैमिलीज बहुत हेल्प करती है। साथ में फिजिकल एक्टिविटीज नहीं होती है एल्डरलीज की, तो उनको सुबह या शाम के लिए वॉक के लिए प्रमोट करें, ये सारी चीजें करना चाहिए। डाइट अच्छा करना चाहिए, वेट रिडक्शन में उनकी हेल्प करना चाहिए। कुछ लोग स्मोकिंग करते हैं तो उनको स्मोकिंग के लिए अवॉइड करना चाहिए, प्रमोट करना चाहिए फैमिली मेंबर होने के नाते। तो फैमिली का बहुत इंपॉर्टेंट रोल होता है।
बिल्कुल। और इस सेशन को हम सम अप करें उससे पहले क्या टेक होम मैसेज आप देना चाहेंगे हमारे व्यूअर्स को?
See, the take-home message is that overactive bladder is a medical condition we all know. Uh, we all know either ourselves or we know somebody in our family or in relations or in friends who may be having all these symptoms. We should not make fun of those people. We should not make fun of those people that they are passing urine every time, they are going to washroom every time, they are leaking urine. We should not get angry on the elderly people if they are doing such things. We should bring them, or we should bring them to the urologist. We should listen to the urologist, get some basic, very basic investigations. No need to fear that you will be advised a CT or a MRI or a direct surgery. You will be advised. No, it is not like that. Very basic investigations, very feasible modifications in your lifestyle. ऐसा नहीं है कि कुछ भी ऐसा बोल देंगे कि आपको ये खाना ही नहीं है, जीरो कर देना है, ऐसा नहीं है। ऐसा ही बताया जाएगा जो आप अपने डे टू डे लाइफ में करते हैं, कर सकते हैं। If not helping, then certain medicines will be prescribed. If you are taking those medicines, if you are taking the advice of your urologist, then definitely you will get benefit.
बिल्कुल, तो जो आज उन लोगों के साथ हो रहा है वो कल हमारे साथ भी हो सकता है, इसलिए उन्हें समझने की, ओएबी को समझने की ज़रूरत है और ज़रूरत है कि अगर सिम्पटम्स हैं तो एक क्वालिफाइड यूरोलॉजिस्ट से संपर्क करें। थैंक यू सो वेरी मच डॉक्टर श्रेयांश चहर, इट वाज वंडरफुल टॉकिंग टू यू। थैंक यू सो वेरी मच फॉर योर वैल्यूएबल टाइम and all the information that you shared with us. Thank you.
Thank you very much. It was my pleasure.
And viewers, thank you for your active participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.